current mechanism. And if you're drinking water constantly, what are you doing to that salt concentration? You're going to pull that out so quickly, the sodium won't be reabsorbed earlier. So you're going to lose that concentration gradient. That's what we call, as you said, medullary washout. And if you have that, you're going to get a little bit of concentration in the urine, but hardly any. It'll be above isosaphenuric, but it won't be normal. Because it's telling you the pores are open, so some of the water will come in, but it's not going to be pulled in like it should. And so in that instance, when they start doing that, then their symptoms are going to get a lot worse, and they'll start drinking even more water. And sometimes you'll see the animal they just have their head in the water bucket all day and all night. Okay, it's going in one end and coming out the other. Okay? Now, urine can be concentrated, as we say, to greater than 1030 in this instance, as long as you don't have the medullary washout, if you restrict water. But again, you've got to be very careful with that, because if they do have the medullary washout, they're not going to be able to respond to that water restriction very well. Okay? So that's where we use the Hickey hair test. You can see H-I-C-K-E-Y, there's H-A-R-E. And it can be used to assess the pituitary and renal tubular ability to reduce urine volume in response to increasing plasma osmolarity. You increase the plasma osmolarity, that can help increase that amount of sodium and urea that's going to go into that intramedullary tissue, and that's going to give you that concentration gradient. That countercurrent mechanism is going to be restored. Okay? And so when that happens, what you do, you take hypertonic saline, it's 2.5% solution, you give it IV. Why don't you want to give it orally? Your blood sodium is probably fine, so what's that going to do to absorption of any more from the gut? Lots of those electrolytes and minerals will be absorbed from the gut in response to what's needed in the blood. So it'll just go right on out. Now, water is not allowed during this saline infusion, because again, you want this stuff to go out and be, you don't want it diluted. In other words, when you get the water, so you want it to go and get into that kidney and get into that intramedullary space there. Now, urine production per minute is determined by draining the bladder completely every 15 minutes during the infusion, and for an additional 15 minutes after you stop the infusion. And remember, it's been 15 minutes, you've got a certain volume, you know how to calculate per units per minute, right? That's what we're doing here. I know it's math. Sorry to say that nasty word, but it's math, okay? All right, so the interpretation, a significant or greater than 25% reduction in urine flow rate is indicative that you basically have restored that medullary washout area, and that there's nothing really wrong with the ADH in that animal. Yes, ma'am?
Can you explain again why you do IV and not orally?
Orally, if you give saline orally, and the salt concentration is not that low in the blood, you're not going to absorb it from the gut.
Okay.
And also, giving it orally can cause actually pulling more fluid out of that animal to dilute it in the lumen, and it will go out. Okay? And it's much easier to get a dosage. If you give it orally, what if the animal doesn't eat? Or if you do it with an injection, well, half of it spills back up at you. So it's much better to give it by a more direct route. Now, interpretation again, as we say, if we got a decrease in our urine flow rate, and we start getting a nice increase in specific gravity and everything, then that tells you you restored it, and is the ADH working and everything? So there's nothing wrong with the pituitary or with the kidney as far as doing that. Okay? And dogs with psychogenic polydipsia should have reduced urine production rates, but not in the case if it's CDI or NDI. In other words, if you restrict water in an animal with CDI or NDI, are you going to change anything as far as what's going to go out in the urine and everything? No. So that tells you that this was, the Hickey hair test worked. The Hickey hair test is not going to do anything if you've got central diabetes insipidus or nephrogenic diabetes insipidus. Everybody follow that? Well, as far as your treatment, water restriction at times, I may have water limitation and behavioral modification. In other words, take them out. If you move to the city, take them out to the park. If you're in New York City, take them to Central Park. Okay, walk them around a little bit and everything. Or if it's another pet, try to assure that animal that we're not replacing you. It's supposed to be your pal. It's supposed to play with you and all this type of thing. That may not be easy, but that's what you do. And very often, this problem is more common in big dogs. And one of the things is big dogs seem to be threatened by little things. So that's when you bring in puppies and things, they say, oh my heavens, what are they bring that in here for? That type of thing, okay? And the prognosis is usually excellent, but the problem is if they did it once, some other change, you may go through the same rigmarole with them. Okay? So we clear on the different types of diabetes insipidus and stuff?
Question.
Mm-hmm.
So if you were suspecting the psychogenic polydipsia, would you do the hickey hair test first just because it's quicker and then lead into the water deprivation?
Well, you can't, if you get a good history, it would indicate that. But you've got to be careful if it isn't that problem and you give, you know, IV administrations of this strong concentration of sodium chloride. What can you mess up a bunch of other things in the body if that's not what the problem is? Yeah. So you've got to, you know, what you do is you do your water deprivation test first, and then go from there. And also take a blood sodium level. Usually, if they're not, the level will be low in that animal before you do this. You know, start with this kidney hair test and stuff. Okay. And this right here, this summarizes everything we've talked about. So what do you think about this table? Yeah, you might do, I know you're going to get the information again in test format. I don't know if it's going to be in a table or anything, but this summarizes what we talked about. The test you do, what you're going to see, results you're going to see with those 3 different categories of disease. Okay. Okay, well, hypersecretion of ADH can occur in 2 clinical settings. There's a syndrome of inappropriate vasopressin secretion, which is SIADH. And in this, the release of ADH occurs in the absence of either osmotic or non-osmotic stimuli. And in humans, it's been observed in different disorders of pulmonary disease, some cranial disorders, neoplastic disorders such as ectopic lung tumors. You'll find that in humans, ectopic lung tumors can cause all kinds of endocrine disorders. This is one of the things you can see this. It's rare in the dog and cat, but it has been reported only in 1 dog that had heartworm disease. Now, that doesn't necessarily mean it's going to be that rare. That just means it may have occurred in that particular one. But is heartworm disease that rare? No. It's not less than it used to be, but it's still problems and stuff. As far as the following administration of some drugs that enhance ADH release or action can cause it. Where some drugs will just do that, have nothing to do with the condition of the animal, it just stimulates those neurons to release, as far as that's concerned. All right, well, yes, thank goodness we have ADH, because what would happen in the desert if we didn't have ADH? We'd have normal urination, and you'd get severe dehydration, and you wouldn't be able to sit on that camel he's sitting on. Okay? All right, well, let's look at this case right here. A client brings in Bucky. He's a 5-year-old male Cairn Terrier with the complaint that the dog has an insatiable thirst and is peeing all over the place all the time. So what's that called? PUBD. Upon questioning the owner, you learn that he obtained the dog from a friend who owned a junkyard. He further confides that he got the creeps when he picked up the dog because the place had a bunch of very aggressive rats and mice. He does not know the dog's vaccination history and tells you that he seriously doubts that the previous owner even knew what a vaccination was. So it's probably not been vaccinated for certain things that we usually vaccinate dogs for, okay? He does know that the dog has no history of previous illness. Now, you examine the dog and find him to be very nervous and slightly dehydrated, still less than 5%. His heart rate and body temperature were normal, and his respiration rate was slightly increased. During your examination, you note numerous small, healed bite wounds on the dog's head and neck. So what has it been having run-ins with? The rats. Those rodents, either the rats or the mice or both. There's no other significant findings noted. Well, a routine CBC blood chemistry and urinalysis were normal except for urine-specific gravity 1.003. So what's the term to describe that? Hypostenuria. Okay. Normal is 1035 mean. Urine osmolarity was 170. Normal is 300. So what is it? Hypoosmolar, right? Which tells you what's happening to the getting too diluted because you're urinating too much water out there, right? Plasma osmolarity was 300, which is normal. Now, he wasn't that dehydrated, was he? Now, if he were 10, 12% dehydrated, that plasma osmolarity would be significantly higher, okay? Well, based upon all the information you have, which of the following should not be included in your presumptive diagnosis, and why not?
Psychogenic.
No.
Oh.
How old is this dog?
5.
5 years, right?
Yes.
What's the likelihood if he had congenital central diabetes insipidus that it would not show anything until he was 5 years old? So that one we can rule out. But the other ones we can't yet, can we? Now, so he probably has an infection or something, but we don't know that. In other words, particularly with Natalie, just because something is in the history, it may not necessarily be pertinent to what you see. It may be put in there to try to steer you the wrong way. Okay, so you have to be very, you got to do this very conscientiously, look at it and everything. Okay. Well, to rule out your differential diagnosis, you decide to perform a Hickey hair test and a modified water deprivation test. No, it's Bucky. I pulled this out in another case I had. Don't pay attention to the name. This is Bucky. The results were as follows. Urine osmolarity after water deprivation. That's when you had a 5% loss of body weight. Was 170. So did it change? No. Urine specific gravity after water deprivation. Did it change?
No.
No. Urine osmolarity after Hickey hair test. Did it change? Urine production rate after Hickey hair test. No change. All right, so now let's look at our things on that. Based upon these results, which of the following has been, or has been definitively ruled out?
Psychogenic and acquired.
This is all the above, B and C, or A, B, or C? Which one? We ruled out psychogenic?
And B.
We ruled out psychogenic because we did the Hickey hair, but didn't get any improvement. So now, what are we left with? Acquired central or nephrogenic diabetes insipidus. All right. And basically, y'all have these answers on your all slides and stuff. Now, to further evaluate Bucky, you perform an exogenous ADH administration test to get the following results. What happened after you gave it? The specific gravity? Nothing. What happened after you gave ADH? In other words, initial and after is the same, aren't they? So these and the previous test results support a final diagnosis of what?
C.
Nephrogenic diabetes. Well, I should put that arrow up one. It came down. It's nephrogenic diabetes insipidus.
So would you recommend starting with the Hickey hair, then going backwards from that?
My recommendation would be to first do the water deprivation test. Now the reason they didn't do it because he was about 5% dehydrated, so they didn't want to start with that. And with the history and everything in this dog, it hasn't had a problem until now, then you would I would do the ADH response test first, but if you don't get any results, have you ruled out any of those things? In other words, if you do the if you give the DAVP and you don't get any concentration or any change, that could still be psychogenic, couldn't it? So this one uses a little bit of fortune telling. Generally, you don't do the Hickey hair until after you do the modified water deprivation and the ADH. Okay? But sometimes if you have more experience with it, you might. Okay. Now, while in the clinic, Bucky's condition worsens. His polyuria persists, and he is now lethargic and appetent and has intermittent vomition. Oh my heavens, we made him sicker by doing our testing, didn't we? No. Over the past 48 hours, he has had significantly reduced thirst. Oh, we cured him, right? On physical examination, his tacky mucous membranes and decreased skin turgor are noted. Based on these findings and a decrease in weight of about 1 kilogram, the dog is estimated to be 10% dehydrated. That's not good, is it? No other new physical examination findings were noted. The serum biochemistry panel revealed moderate azotemia. Urine specific gravity was 1.009, which is in what range? Isocyturic range. Usually means where's your problem? The kidney tubules. Okay. Urinalysis was 2+ protein and 3+ blood. So we got something. What's the problem? What's causing that nephrogenic diabetes insipidus?
Can you do it?
renal disease. Okay. Abdominal ultrasound revealed mild to moderate bilateral renomegaly. The kidney had a rounded, swollen appearance with increased echogenicity of the medulla. It's the normal kidney over here, and see the pin's big. Does that mean it can't have renal failure? It's bigger? That's a cute renal failure. One in there, okay? Y'all see how big that thing is? Now, you prepare a sediment of the urine and stain it with right stain. Results are pictured below. What's your interpretation? What you got? Well, you got spiral keys. It's probably lepto. You could do testing on that. It was lepto. So how does that relate to his history? Right. Remember, rat bites and mouse bites are one way that stuff is transmitted. Okay. Now, what should you, with this condition, should you go back and suggest that the owner go get checked out? Yes, because those things, they don't care whether you're human or not human. You know, they're gonna get you. Okay. So we clear on that one? Well, what about this cute little thing? 3-month-old male schnauzer. History of excessive drinking and urination. The owner states that this behavior has been going on since shortly after birth of the animals. What's that give you a hint this might be? Congenital. It doesn't necessarily have to be done. It could have gotten a renal toxin or something. So you can't, just don't jump to all those conclusions yet. A routine CBC blood chemistry and urinalysis were normal except for urine-specific gravity 1.004. So does that kind of rule out that there might not be anything wrong with the kidney or anything like that? The urine osmolarity was 120, and plasma osmolarity was 300. So again, the plasma is all right, but what's the kidney not able to do? Concentrate. So based upon this information, which defines the most likely diagnosis? Probably congenital central diabetes insipidus. And again, however, though, can you really say that's what it is? So you should still do testing. So to help you diagnose, to help in your diagnosis, you decide to perform modified water deprivation tests and an exogenous ADH administration. Urine osmolarity after water deprivation, did it change much? How about the specific gravity? How about the urine specific gravity after ADH administration? So what have you ruled out? Ruled out psychogenic and nephrogenic. So what's left? So what do we got here? Support a diagnosis of
congenital central
diabetes insipidus. Would DDAVP be effective in this animal's treatment? Treat this animal's condition? Yes. But if it's nephrogenic, it's not going to be because the receptors aren't working. But this, you're replacing the cells that are what's it? ADH. Okay. Easy? Make sense? Now, if y'all bear with me for a few minutes, let's finish these up, and then I might give you a little break next week. All right, this is you are presented with a 6-year-old female Great Dane with a history of drinking a lot of water and urinating all over the place. The owner states that this behavior has been going on for the last 4 months. Now don't ask me what kind of common sense this owner has. Do you want a Great Dane doing that all over the place for that long without trying to find out what's wrong? I'll tell you, over 5 months there. Coincidentally, this behavior started soon after the owner brought a new dog into the household. And look how he's looking at that new dog that came into the household. He said, "What are you doing here? Get out." Well, you examine the dog and find a well-hydrated dog with no obvious signs of illness. Routine CBC blood chemistry urinalysis were normal, except again for urine-specific gravity 1.03. Urine osmolarity was 180, and plasma osmolarity was 310. So again, your urine values are abnormal, right? Well, based upon the observations, which of the findings should be included in your presumptive diagnosis?
psychogenic.
The only one?
All of
You need to
them.
include all of them at this stage. Okay? Because even though you think, well, psychogenic, but not necessarily going to be that, is it? And so you can't just say, well, we're not going to worry about testing for the other stuff. All right? Well, you decide to perform a modified water deprivation test. And urine osmolarity after water deprivation, 190. Urine-specific gravity after water deprivation, 1.003. So then, did we correct the problem? So based upon these results, which of the following statements are true? Psychogenic polydipsia cannot be definitively ruled out because the prolonged polyuria may have resulted in renal medullary washout of sodium.
True.
All right. Psychogenic polydipsia can be definitively ruled out because of the failure of the urine to concentrate.
False.
Well, the first one's true. That one's got to be false, right? How about central diabetes insipidus and nephrogenic diabetes insipidus can still be considered in the differential? True. So basically,
A and C.
it should be A's. The arrow's dropping. I apologize. The arrow should be up there. Okay. Make sure you make that notation in your own thing there. But the arrow should be up. The problem when I do this on my Mac, and when I come in here and present, do it on these things, it drops down on me. Or when I save it on Blackboard, Blackboard says, I like the arrow down here better. Okay. Well, to further evaluate the dog, you perform a Hickey hair test and obtain the results. Before, 1.03, 180 as far as osmolarity. What happened after? Everything increased. So what was the kidney then able to do? So what does this support a final diagnosis of psychogenic polydipsia? Does that make sense? Y'all follow the cases help you understand the principle?
Yes.
Thank you for wait. Actually, you only gave me half a minute. So. We started a minute and a half late, so no, we all.
Oh, come on.